Welcome back. We're now on video 3 of the initial program training. We're now going to be looking at chronic disease risk factor screening from the clinical perspective. So as we said before, there are 4 parts to the screening: obtaining the informed consent, reviewing the health intake questions, performing the clinical screening, which is what we're going to be doing now, and then we'll be looking at conducting case management in the next video. So first thing we want to do then is to pull up the screening form and take a look at it, and this is the screening form. You can't really tell much about it like this, so we're going to break it down individually and take a look at it. So we're going to be looking at the body mass index for the woman. You get body mass index from height and weight, and there's a formula that you can use. We also have a BMI wheels, there are BMI charts, there are places you can go on the internet to put the numbers in to come up with the BMI, but this is where we're going to put it in here. So we're going to put the woman's height and her weight, and then actually come up with the BMI. Now the thing about our screening form is it is a decision-making tool. You'll notice on here that it has, when you refer someone for medical evaluation. In the case of body mass index, we're not going to be referring for medical evaluation, but we're going to be letting her know that it is a risk factor. So let's take a look at a sample one here. So let's say that her height is 5'3", which is 63 inches. Her weight is 152 pounds. So that would put her BMI at 27. And as you can see, 27 is in the overweight range. So that's not too terribly bad. And most of the women that we see in our program tend to be either in the overweight or obese categories, although we do have some occasionally that are underweight or in the normal categories. So that is the body mass index, and that's where you record that. Next thing we're going to do is blood pressure. Now with blood pressure, we need to take 2 blood pressure readings, and they really need to be about 5 to 10 minutes apart. What a lot of people do is they'll do one blood pressure reading when she comes in, and then they'll do some of the other things, and then they'll do the other blood pressure reading later. But we're going to get an average of the blood pressure readings, and then that's going to determine what category they fall into. So let's take a look at a few different ones and see what categories they fall into. So let's say her blood pressure average is 125/85. If you look at the 125, that falls right into the prehypertension, 120 to 139, and the 85 also falls into the prehypertension, the 80 to 89. So she would be in the prehypertension range. Let's take a look at another one here. Let's say that her blood pressure is 142/88. So the 142, if you look, falls into the stage 1 hypertension, whereas the 88 is back down in the prehypertension. So what category would she be in? Well, because the stage 1 is higher, that's the category we would put her in. So if the 2 numbers, the systolic and diastolic, are in different categories, always go with the higher category. All right, let's take a look at another one. Let's say it's 128/92. So the 128 is in prehypertension, but the 92 is in stage 1 hypertension. So even though the first number is a lower category, the second one is in stage 1 hypertension, which is a higher category, so that's where we're going to place her. All right, let's take a look at one more. Let's say her average is 168/114. So the 168 puts her in stage 2 hypertension, but the 114 is above 110. That puts her right into the alert category. Now I'm not going to go into the case management right now, but we will be talking about that in the next video, and we'll talk about exactly what needs to happen with that. Next thing we want to look at here is her cholesterol. We use the Cholestech machine, and the cassettes that we use give us total cholesterol, HDL, and glucose. So we're going to see what we need to do with this. Now, we really want the woman to be fasting when she comes in, because if she's not, then we can't use her glucose number. But we can still do everything. The total cholesterol and HDL, she doesn't have to be fasting to do that. We can still get those numbers. So let's say she has total cholesterol of 276. That would put her in the high category. So if she has high cholesterol, if it's in the high category, we're going to refer her for fasting lipid profile and a medical evaluation if she's not currently being treated for high cholesterol. And you can see that right on there. If she's borderline high, we're going to do a fasting lipid profile, but we're not going to, and if she's not being treated for high cholesterol. And if the LDL from that is greater than or equal to 160, then we're going to refer her for a medical evaluation. And if it's normal, we're not going to be doing anything. But the key is looking at whether or not she's being treated for high cholesterol, and you can find that out on the health intake, that very first page we looked at with the cholesterol. We asked if she had been told she has high cholesterol and if she was taking medication for it. All right, let's take a look at her glucose. Let's say her HDL. Let's say her HDL is 34. So 34 would be in the undesirable range. That would be below 40. Another situation where we're not going to immediately send her for a medical evaluation, but if she's not being treated, we're going to send her for a fasting lipid profile. And if the LDL from that fasting lipid profile is greater than or equal to 160, at that point we're going to refer her for a medical evaluation. And then now we'll take a look at glucose. In this case, let's say it's 137. That would fall into the diabetes range. The key to the glucose, to this reading, the cassette that we use is going to give you a glucose reading, but you can only use this glucose reading if the participant is fasting and has no history of diabetes. If she's not fasting, or if she does have a history of diabetes, you're going to pretty much ignore this reading because we're not going to be doing anything with it. But if she's in that, if this is a reading we're going to use and she's in that 137, which is the diabetes range, and she does not have a history of diabetes, then we're going to send her for a fasting plasma glucose so we can get a confirmation of the high reading on a different day, and then we're also going to refer her for a medical evaluation. If she's in that 137, or excuse me, if she is fasting and she's in that prediabetes range, so that 100 to 125, in that case, we're not going to refer her for a fasting glucose or medical evaluation, but we can refer her to the diabetes prevention program if she doesn't have diabetes already. And then the last thing is the A1C. So if you have a woman that has no history of diabetes and she's not fasting, you can refer her for a laboratory A1C with a venous blood draw. So that's a woman who does not have diabetes, and she's not fasting. So you've got a glucose number that you can't use, but we have to have either a fasting glucose or an A1C for every woman in our program. That's one of our program requirements. So in that case, if you can refer her out and have a laboratory do it. You do have an Affinion A1C machine there, but you're not able to use that to diagnose diabetes. So you can only use that for women who already have a history of diabetes. And speaking of that, so we have the hemoglobin A1C there at the bottom. So if you have a woman who does have a history of diabetes, make sure you use that Affinion machine and get the A1C right there in the clinic that day. And then you can write that in there, and if her reading is below 7%, you don't need to do anything, but if it's above 7%, then you want to send her back to whoever's treating her diabetes to talk about glucose control. If she's not seeing anybody, then go ahead and refer her for a medical evaluation, because we need to talk to her about getting the glucose under control. Then the questions that are at the bottom here, these are all important questions, and they all need to be answered. So was the client referred for medical evaluation? Yes or no? Was she referred for lab work? We need to know whether or not you referred her. The next two, alert value case management and hypertension case management, were those required. If you say no or you don't say anything and she did require either hypertension case management or alert value case management, I'll be contacting you to ask what's going on, making sure that the woman is being followed. So make sure that you're letting us know when you're referring somebody for, or whether you're doing the case management for them. And then the one about risk reduction counseling complete, that's really important too, because we really want to make sure that every woman has her risk reduction counseling done, because we need to let her know what her risk factors are. All right, so the screening is done, and now we need to see if she needs to be referred for a medical evaluation? If so, we have a form for that. Not everybody uses this form, but we do have it available in case you do want to use it. And so you put in the client's name, date of birth, the NBCIS ID, and then who you're referring her to, what the provider's name is, or the clinic name, and who's referring her, either your name or the agency that you work for. And then the reason that you're referring her. In this case, we're saying that she has elevated blood pressure of 142/88. And we're saying that she has a history of hypertension, and so we want to evaluate her and see what's happening. Also, you see the checkbox, the box is checked for the client needing physical activity clearance, so we're asking the provider to do that as well. That's the top portion of it. That's where you complete it, and you'd also sign it and date it. And then the bottom portion is completed by the healthcare provider. So we put the date of the evaluation, what her blood pressure was, what happened, what they did. And we don't need a lot of information here, but just a little bit of something here. They increased her medication. We're also looking at, they told her to get more exercise, to cut back on her sodium, and to monitor her blood pressure at home. And then you see that she's also been cleared for physical activity. Then at the very bottom, we have the checkbox for the office visit CPT code. That's really important that the provider's office checks that so that we can put that into the data system so that they can actually get paid. Because if they don't check it, or if they check the wrong box, then it makes it more difficult. We have to fix that on the back end later on. So, and it will delay them actually getting their payment for the office visit. All right, so that is the referral for medical evaluation. All right, so in summary, what we've talked about during this video, we've looked at body mass index. We've talked about blood pressure, the fact that you need to get 2 readings, at least 5 to 10 minutes apart, and then you'll average them to determine what level she falls into. We talked about total and HDL cholesterol, and if the woman is actually being treated for it, that you wouldn't be referring her for anything. We talked about fasting glucose and the requirement that every woman has either a fasting glucose or an A1C. And then for the A1C, we can do that in the clinic right there with that Afinian machine if she has a history of diabetes if she has a history of diabetes. But if she does not have a history of diabetes and she's not fasting and you've got a glucose reading that you can't use, then you can do the blood draw, the venous blood draw, and have that done by a lab. And then finally, we talked about the referral for medical evaluation, and that's a form that you can use to refer the woman to one of the participating WISEWOMAN providers. All right, next video is going to be our last video, and we'll be talking about case management. We have 2 levels of case management, or 2 types of case management, I should say: hypertension case management and alert value case management. So I look forward to talking with you then. Thank you.